There's a reason why all health starts in your mouth, and if you have a chronic healthcare concern, it may be associated with your teeth, either an infected tooth or a root canal or some type of unresolved dental complication. Check it out. Hello everyone, Dr. West. I'm so excited to share with you a health tip about how to get rid of chronic disease and improve so many things associated with fatigue and with brain fog, chronic skin problems, irritable bowel syndrome, ulcerative colitis, anything to do with your GI system. And it's not what most of you think. It's actually associated with your teeth health. I've actually been on this journey myself. I'm going to tell you two amazing stories about how teeth health absolutely change someone's life, their quality of life, and their whole parameters for health and function. So the first story I'd like to tell you about that is my own story. I was playing a high school basketball game. I got my tooth knocked out on accident by an elbow, and it became loose. It actually came out, and I put it back in and was hoping that it would be healthy. And the tooth stayed in. But what happened is a little bit after high school, I was on a mission for my church, and that tooth turned black. Not only did it turn black, but what happened is I started getting horrible cystic acne. Now, I didn't know that there was a correlation. I went to a dentist, and they bored out the back of the tooth. They put some bleach in it. They did actually a root canal. They changed the color of the teeth, almost how it was before, not quite. But I just had major skin problems in my arms, behind my knees, and again, acne problems. I came home, and one day I was feeling with my tongue on the roof of my mouth here, or actually out here on the front, and it felt like a little bit of a pea-sized clear balloon. And I was kind of looking at it, and I'd kind of push it, and it hurt. And anyway, my dentist told me that was an internal resorption problem, and that there was an infection up in the root canal, and what happened was it was coming out through the bone. And so they went in, they pulled the tooth, they did an oral surgery, and they cleaned out all that necrotic tissue. And when they pulled the tooth out, I turned to the hygienist, and I said, "I'm really sorry, but your breath is horrible." And she looked at me, she said, "Actually, that was coming from you." As soon as they got cleaned out, what happened is my skin blemishes cleared up, my acne went away, the rashes went away. It was poisoning my entire system. I also saw that with a case for my dad. He had a tooth, a molar down here. They had a crown over it. It had some mercury filling or a post or something like that. He bit down on a walnut, it cracked. He got mercury in his GI system and developed scurvy. Now, scurvy is something that we thought was cured hundreds of years ago because we were taking oranges and limes and we were having the sailors eat those fruits and would put vitamin C back in your system. But if your teeth aren't healthy, you're not healthy. Since then, I've done a lot of work and reading and been to seminars about the different things in your mouth. And so from my perspective as a holistic healthcare provider, I think it's really important to get the amalgams, the silver fillings, out of your system. I think it's important that you go to someone that knows how to do it, that puts in a ventilator and has a dental dam and takes the metal out the right way. I have had people go to the dentist to get the amalgams pulled out and they don't do right and makes them really, really ill. So go to someone that knows how to take them out the right way. Also a consideration for root canals. I've read a lot of books. One of my favorite ones is called All in Your Head and Unlinking the MS Connection, but I see horrible GI problems and peripheral neuropathy problems improve when you get rid of root canals. In my opinion, I don't think there's such thing as a good root canal. And as strongly as I feel about that, I think there's other providers, and again, dental specialists and oral surgeons that'll say, we've come a long way since the old type of root canals. I'm just saying what I see in clinical practice. When you get rid of root canals, when you have a chronic healthcare condition, almost invariably I see people improve. And so having a great smile and having great oral health is so important for your overall health, and working with biologic dentists and for dentists that believe that all health starts in the mouth, I think is a critical component. If you're having a chronic healthcare condition or you don't feel it yourself, you need to go see someone to make sure that everything's healthy, that we don't have any chronic infections, and you want to get rid of those metals in your mouth. I don't like it when you have a silver filling and a gold filling in your mouth, because now you have different types of metal that actually sets up almost like a battery, and you have electricity that's going across your meridian and throwing off your whole system. And so I think if you are to have metal fillings, at least have that same type of metal, but even better, some type of ceramic or composite. And again, I'm not a dentist I'm not an oral surgeon or a specialist in that area. I just know what I see in practice of seeing thousands of patients over the last 17 years, and I see a lot of people get better by having a healthy mouth. No root canals, no fillings, and that's my thought on how to get healthier. This is Dr. Jason West. See you on the next video. Thanks for watching our video of why teeth health are so important to your overall health. If you liked the video, please give us a thumbs up. And if you really like it, click on the little bell over here and you'll get an email every time we do a new video.